Hello friends, I am Dr. Raktim and I am here to discuss on a topic of measurements of mortality. Let us begin. What is mortality? Mortality refers to the occurrence of death in the population. Universally, most studies begins with the data on mortality. It tracks the impact of death from a particular disease, injuries or other causes. Today, in this topic, we will be covering the measures of mortality. We will be discussing about the crude death rate, specific death rate, case fatality rate, proportional mortality rate, and the survival rate. These are just few of the indicators of mortality. There would be many more, but in this slide, we would be discussing on these points. Let us begin with crude death rate. Mathematically, crude death rate is calculated by total number of deaths during a year divided by the mid-year population, and it is multiplied by 1000. Here, in this case, the number of death may be because of any reason. We will not, it is not important to know the reason of death. If there is death, we will be taking under consideration in our numerator. In the denominator, we are writing mid-year population. What is mid-year population, my friends? Mid-year population is the population of a specified area when the data is collected on 1st of July. I repeat, 1st of July. Why we are collecting it on 1st of July? 1st of July is the mid of that year, and we generally believe that the population will not fluctuate so much in the mid of year, and thus we are accepting 1st of July as the mid-year population. Coming to the crude death rate again. Crude death rate, see, it's comparing two different regions. How much is the death rate of the two different regions? But it lacks comparability because the population or the community uh, may have different age pyramids, the gender would be different, it would not be matched. Okay, so thus we can say that crude death rate is not a good indicator, but however, when the data is not collected properly or is maintained properly, then crude death rate is the only indicator that we can use. So it generally gives us the basic snapshot of that population and their general health status. Moving forward to the specific death rate. Specific death rate, as the term suggests, it refers to a particular etiology or the cause by which the death has occurred. It is generally classified as cause or this disease specific death rate, or it may also be age specific death rate, gender specific death rate. Okay, age specific death rate is one of the most useful measure of mortality. And since specific death rate will have a specific reason to it, specific disease, specific etiology, or the specific population involved in a disease, so it's a better indicator than the crude death rate. Since the denominator here is defined. Okay. Now, moving forward to the presentation again is the case fatality rate. Mathematically, case fatality rate is the number of death due to a particular disease divided by the total number of cases due to the same illness multiplied by 100. Thus, case fatality rate denotes the killing power of the disease, and ultimately we will know the virulence of the organism for that disease. It is most useful in case of acute illnesses like food poisoning, measles, etc. It has got a very limited role in chronic diseases because the death in chronic diseases will occur very late compared to the total number of cases involved. So the case fatality rate would be a very small number. So for chronic diseases, we generally tend to avoid the case fatality. But for the acute illnesses, it is very important. It helps us to compare the treatment strategies, the public health interventions. It helps us in guiding the clinical prognosis of a disease and finally the resource allocation for a particular disease. With that, case fatality rate is a very important indicator of mortality in case of acute illnesses. Moving forward to the proportional mortality rate. Proportional mortality rate measures the burden of a disease in the community because it is calculated by the proportion of total death due to a particular cause or a disease and in what age group. Thus, we will have the idea of the leading cause of disease in the age specific, gender specific, or cause specific reasons. Few of the examples of proportional mortality rate is given subsequently. It is the proportional mortality, which is specific cause, is the number of deaths from specific cause divided by the total deaths in that specified time multiplied by 100. Under 5, proportionate mortality rate is the number of deaths from the specific cause divided by the total deaths in that specified time multiplied by 100. So, with the proportional mortality rate, we will be able to know where our funds must go in order to reduce the mortality rate of the particular age, particular population in the particular community, and then we will be able to devise the various health programs, area specific health programs, how to tackle the problem. And in a resource limited setting, sometimes no other available data is there. We only have to depend upon the proportional mortality rate, and then we have to develop our health interventions, and as such the resources are allocated accordingly. Lastly, coming to the survival rate. Survival rate, it is useful to know the prognosis of a disease treatment. It helps us in the assessment of the outcome of the standard therapy. It is calculated by the total number of patients alive after specified period divided by the total number of patients diagnosed or treated for that particular disease. It again points towards the prognosis, the treatment proper, how is it given, how virulent the organism or that disease is, and ultimately we will be able to decide better that whether the fund or the national health program is required for that particular disease or not. That's it for the uh, presentation, my friends. Thank you so much. And if you have any questions or comments, you can always comment on the chat box. Thank you.